We're talking to Kristen Melmo
Yes.
about this event here. What's happening here, Kristen?
We, the nurses, supported by WSNA at Peace Health St.Joseph Medical Center, are having an informational picket because we're out of contract, and we are trying to get Peace Health to understand that we need more from them when at the table.
And you've been out of contract for how long?
We've been out of contract for almost a month now, but we've been negotiating for 4 months.
And what's the name of the union?
WSNA, so Washington State Nurses Association.
And how many members do you have?
About 1,100 nurses.
Are they all out on strike?
We're not on strike. This is an informational picket. It happens before a potential strike. We don't know if we'll strike. It all depends on if Peace Health hears us that we need affordable health care, that we get a choice and a say in to see the providers we want to see, and to have competitive wages to the other Peace Health hospitals.
So what do you do at the hospital yourself?
I'm a labor and delivery nurse.
That's a lot of work.
Yeah.
Do you enjoy the job?
It's rewarding work.
Uh-huh.
Yes.
How long have you been doing it?
I have been a labor and delivery nurse for 5 years. I was an ER nurse before that for 5 years.
A lot of people here.
Yep. Good turnout today.
It is a good turnout. I'm glad it's not raining.
Me too, definitely.
Well, thank you for your time, and give us a website we can go to for more information.
If you just Google WSNA St. Joseph Medical Center in Bellingham, it'll come up with the link to our local unit homepage, and that'll have at the very bottom, it'll have all of the updates of like where we are in negotiations.
And you have been getting a lot of support from people driving by.
Yes.
I noticed that.
Yes. And we've been going to the city council meetings, and we got city council members here. We got a lot of community support, and we thank you for that.
Thank you for your time.
Thank you.
We're talking to Tracy Taylor here about things she went through when she got injured with her health insurance. Tell us all about it.
I fell and broke my leg in November, on November 29th, under our previous health insurance, and the coverage was great. I think I maybe paid $200 out of pocket for surgery, everything related to that. And then after the first of the year under our new insurance, MODA, I got infected. My incision got infected. I had a 3-day hospital stay for IV antibiotics. And as of now, it's cost me $10,000 out of pocket with the new insurance. So the deductibles are too high. We don't really have any Tier 1 coverage up here in Bellingham. So everything is higher. And it's really hard for I imagine for families and single people that are having to deal with this. It was not easy for me, but for people that are less fortunate than myself, certainly, younger nurses, it can really do you in.
So how long have you been a member of the union?
I started at Peace Health 13 years ago in hospice, and hospice is not part of the union. There was a drive to get us in with the union. The hospice nurses weren't quite sure, so I helped the acting board member of the union bring the hospice nurses on board. We put it to a vote. And I have to say, people that were on the fence at the time are really happy now that they're with the union, because we get so much support, so much advice, and they really stand up for the nurses' rights.
Tracy, thank you so much for your story. We appreciate it.
Thank you, Leo.
We're talking to Brian Martins
Yes.
about this event. You're a nurse here.
I'm a nurse here, correct. Yeah.
So what do you do?
So I work in the post-anesthesia care unit, so we're getting people ready for surgery and then sitting with them right as they're waking up from anesthesia.
That's an important job.
It's an important job. Yeah.
So what's happening here today?
So we're having an informational picket to demand a fair contract from Peace Health, demanding better wages, better health insurance, some recognition for the work that we do, equal pay to comparable hospitals.
So you had an old health plan that was really good. Now it's changed a lot, hasn't it?
It has changed a lot. Just I can't speak for everyone else, but my premiums and my out-of-pocket and deductibles, everything's increased by about twice. So I'm paying about double that I was just in January. And that alongside with just inflation and the cost of everything else, it feels real hard. It feels like we're working harder and we're making a lot less. And we're angry about it. We want to be able to take care of the people in our community, and we don't feel like we're being given the tools to be able to do that effectively and safely. So we're here asking for community support and just showing up.
What's the name of the union?
The name of the union?
Yes.
Washington State Nurses Association, WSNA.
And there's a website.
There is, absolutely. Yeah.
Brian, thank you and good luck.
You're welcome. Thanks for you.